So here's a conversation we're having later on. As the world marks World AIDS Day under the theme Overcoming Disruption and Transforming the AIDS Response, Kenya is confronting a worrying setback. The Kenya AIDS Response Progress Report 2025 shows a sharp rise in mother-to-child transmission of HIV, which has now surpassed the 9% mark for the first time in years. The report also highlights Nairobi County as having the highest number of new infections, while several arid counties are recording alarmingly high rates of infants being born with HIV. Mary Mwoki has more.
For more than 2 decades, Kenya was hailed as one of Africa's success stories in the fight against HIV. But tonight on World AIDS Day, those hard-won gains are under threat. New data from the Ministry of Health shows that mother-to-child transmission has risen sharply from 7.3% in 2023 to 9.3% in 2024. Almost double the global target of 5%. Even more worrying, the Kenya AIDS Response Progress Report 2025 reveals 8 counties recorded rates above 20%. The counties comprising Wajir, Mandera, Isiolo, Samburu, Garissa, Baringo, Marsabit and Kilifi record levels not seen in Kenya in over 15 years, with 1 in every 5 babies born to HIV-positive mothers infected. The National Syndemic Diseases Control Council attributes these to a number of factors.
Particularly, we are concerned about 6 counties in this country which have recorded unacceptably high levels of mother-to-child transmission, late initiation onto care when she is pregnant. Number 2, she is on ART when she's on antiretroviral therapy when she is pregnant, but she drops off in the course of the pregnancy. Number 3, during she gets infected with the virus during breastfeeding. And number 4, she drops off antiretroviral therapy during breastfeeding.
The council, however, says they have instituted measures to curb the mother-to-child infections, key among them ensuring every expectant mother attends all the antenatal clinics without fail.
So it also is cultural and social in nature, because you find that there are some communities in this country where unfortunately the woman cannot make the choice to access health services. So if she's pregnant, then she has to depend on the husband or on the partner to make that decision, or the mother-in-law to make that decision if she's going to seek healthcare services or not.
Even so, the government is assuring the public that there is no cause for alarm, noting that the figures reflect the large populations in these urban areas.
So it's not unexpected that you will have a higher number of infections in Nairobi as compared with other counties, all right? And remember, if you look at all these counties, they are the ones which are having the highest burden, and also they have the highest number of new HIV infections. They are concerned that there are certain subpopulations that are showing up these cases, and those are the ones which you must address.
The National Syndemic Disease Control Council says the government will intensify interventions, especially in the most affected areas, including tracing pregnant women and expanding doorstep antenatal care, with the goal of reducing mother-to-child transmission to 5% by 2027. But with only 5 years left to meet the global target of ending AIDS as a public health threat by 2030, the clock is ticking louder than ever. Mary Mwoki, Citizen TV.